think it's what I said up on stage, that we've got to involve all of our nurses and understand from them what it is that they need. They are the ones on the front line. They're the ones with the ideas. Some of our young nurses, some of our student nurses have great ideas and understand the tech potentially better than some of us that are a little bit older. So I think it's about embracing that and listening to them and not being afraid to take other people's ideas. I think sometimes as leaders it can feel a little bit scary that we're taking those ideas from people potentially less junior than us. I don't think it's about that. I think it's about using the expertise and building on that expertise so we can get what we need for our patient care. Yeah, definitely. I think it's important. So obviously my sector has been predominantly in the community, and it's more difficult, I think, looking outside of England because community is very different in different parts of the world. But I think there's definitely different parts of technology that we can look at across the world and how it's being used. And actually in places like Holland, there are other models of nursing out there that have a flat structure, as Steve described, around not necessarily having chief nursing officers, but actually letting the teams do that self-management. And there is the Bertsold model in that area as well in the community. So yeah, there's definitely something about us not necessarily needing somebody in charge. Yeah, I think it's really important. I think we need to build on today. I know that there was a massive waiting list. I think that shows the energy and commitment out there from people wanting to come to things like this. So I think today helps us understand how it feels for people, listening to leaders, listening to people in the fields, the experts talk about things, but also thinking about that first-hand experience that people have got. I know some of the breakout tables are talking about those things and what that looks like. I think we need to do more of this and build on it to get that energy throughout our nursing workforce and not just in an elite few people. I certainly know of nurses out there that haven't necessarily got a title of CNIO, but are really, really engaged in this and really committed to digital and looking at how we use technology to make a difference to patient care. So yeah, I think we need something bigger and broader, but this is a great start. I think my key message is that patients don't exist in isolation. So patients exist across the different fields of practice and the different areas of practice that we have nurses in. So patients will never just be a patient on a ward. They live in their own home. They might live in a care home, they're registered with a GP practice. So think about that care across the spectrum and not just hospital centric, I think is really important. Yeah, lovely. It's always nice to network and get a chance to talk to people that you've not seen for a long time.